Goeiedag, good day, fellow South Africans and citizens of the world. And this is a completely horrific report about the incompetence of the public health system in South Africa. When you got coronavirus sitting on your doorstep ready to invade the country, and you got the township system, and you got a completely crappy public health system, it's a perfect storm, as I've said before. What I'm talking about is just this classic example of incompetence. Let me show you an image to start off with, and we'll discuss what this image is all about during this video. Okay, that's an image of this lady's stomach after she was operated on and discharged from hospital. Yeah, I know it sounds shocking and unbelievable, but that's a fact. Let me give you the story. Now, remember, the names of the people in this story have been changed to protect their identity. On December the 5th at 4 p.m., Mrs. Gracie Kearns, this is last year, arrived with her daughter, Mrs. Susan Coombs, at Witbank Provincial Hospital. Mrs. Kearns had been vomiting uncontrollably for 3 days by the time she eventually made her way to seek medical assistance. You know why she took 3 days? Because she knows the public health system in South Africa is a deathbed. But eventually she was desperate. Mrs. Kearns had been vomiting uncontrollably for 3 days by the time she eventually made her way to seek medical assistance. An ambulance had to be called to transport Mrs. Kearns to the hospital due to her frailty. Nearly exactly 12 hours after Mrs. Kearns arrived at Witbank Provincial Hospital at about 4 a.m., she was finally able to see a doctor. The ambulance that took her to hospital was in a terrible state, Mrs. Coombs, Mrs. Kearns' daughter, explained. The doors didn't close. They had apparently been kicked off their hinges by a previous patient. The stretcher was also problematic, as it wasn't very maneuverable and led us to having to shuffle my mother around the house to get her to the stretcher. Mrs. Kearns was admitted due to her condition but was discharged the very next day. A week later, Mrs. Kearns' condition had worsened. Mrs. Coombs said forlornly, "My mother came to wake me up to tell me that she was ill. She never wakes me up for anything." Another ambulance had to be called to fetch Mrs. Kearns from her daughter's house in Extension 41. "It was broken when it got here," Mrs. Coombs stated. Mrs. Kearns was again admitted to Witbank Provincial Hospital, where she was allegedly told they needed to perform blood tests, but that they were unable to do so because they didn't have water. Mrs. Coombs lamented, "I'm not even sure how that works, but shortly thereafter I was called to one side by my mother's doctor. He told me that she needed an operation, but that she was currently too weak to operate on. He told us that they would need to keep her there until she was stronger before they could do anything for her. The next day they started giving her plasma, and the day after that I got a call from my mother's partner. He told me they were preparing her for surgery. They didn't let me know at all, despite my name and contact details having been taken down as my mother's contact person. After the operation, the doctor came to speak to me and explained that they had fixed a hernia, but they also had to remove part of her stomach." Now, let me just replay that image post-operation. It's absolutely disgusting. On December the 26th, 9 days after Mrs. Kearns' operation, Mrs. Kearns was discharged once again. Mrs. Coombs explained, "I asked them not to discharge her. There's no one at home to look after her. I leave at 6 a.m. for work every morning and only get home late. My husband is a paraplegic himself and can't even access my mother's room from his wheelchair. Plus, I don't know the first thing about nursing or wound care. I work in security." They sent her home with 12 Band-Aids and a box of drainage Band-Aids. After I took her home, I drove to the hospital and had a chat with her doctor, explaining the circumstances to him. He told me to bring her back to the hospital, which I did. She was readmitted upon arrival at the hospital. I accompanied her to the bed in the surgical ward when I was suddenly stopped in my tracks by a male nurse who wanted to know why I brought my mother back. I explained to him I was having trouble with wound care, to which he replied, "What do you mean? It's as easy as 1, 2, 3. After Mrs. Kearns' readmission, a junior surgeon approached Mrs. Kearns. She explained the circumstances surrounding my mother's health. Her very low blood pressure, the septic wounds and heart failure, she told me. "I'm just telling you so that if anything happens to your mother, you can't blame anyone." Thereafter, a social worker from the hospital came to see me and asked why I refused to take my mother home. I explained to her again that there would be no one at my home to take care of my mother for most of the day, and thus, due to her immobility, this wouldn't be practicable. Mrs. Kearns was again discharged against her daughter's wishes. Mrs. Kearns was so gravely ill at this point that Mrs. Coombs had to pay a private ambulance to fetch her at the hospital and bring her home. They just removed part of her stomach, but the only pain medication that she was prescribed was Pain Block, which is similar to grandpa powder in strength and efficiency. When my mother got home, she was covered in bed sores her nurses hadn't known about, leaving me to suspect that they didn't change the sheets even once during her stay. Let's have a look at that image. Mrs. Kearns is currently still at home with her daughter. She is slowly but surely regaining her strength, though her daughter is still concerned over the surgical incision which has yet to heal. Okay, now this is South African public health system. When we talk about the coronavirus, need I say any more? Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. And stay out of public hospitals in South Africa. They are a complete and utter disgrace.